speaking, is a very difficult path to walk. A path of pain is a path of loneliness. It is not a path that people at the time that I had issues and I was on the wheelchair, it was as if the whole world moved ahead and forgot about me. But I will not hold people responsible for it. I've gone beyond that. And now we want to help our younger ones. I want to plead to the medical personnel in the house, doctors, nurses, black people. Speak to warriors. Learn to listen to them. Sometimes, I'm not saying all, I've met doctors, I've been friends with doctors, with healthcare people. I love people, they are my best of friends. I know my nature, so I know I need to make friends with them. When you see people that have what you want, what you need, you must make friends with them. Some warriors will find us, they will find doctors. At the end of the day, you are the one losing. That is just the truth. Make friends with anywhere you know you this person is doing great where I want. What I need, make friends there. I have so many of them as friends. I want to appeal to the healthcare sector. Please listen to warriors. Sometimes you make up your mind even before they finish talking. You make up your mind and you see some of them, they actually don't want to go to the hospital. Let's learn they are not drug addicts. And then we want to equally appeal to employers. Don't disqualify them before you meet them. Once an employer knows this is the sickle cell, it looks like a bad market. Sickle cell is very expensive to maintain. We don't want to be begging. Give them the opportunity, especially when you know they can do these things. Yes, sickle cell is something that makes you to disappoint sometimes, but sometimes you are just well today, and the next minute you are in pain. And I've told you I'm coming that next minute, and then I'm down, I can't make it. But it's not an every time. And that's why we must give allowance for these things. The way that God has made the world, you have the needy there, you have the sick there, you have the poor there, you have the rich there, you have the ones that are the solution providers. That is what makes the world, and we must learn to accommodate all. In your employment, have a space for this. And sincerely speaking, it is a very expensive thing because it is lifelong. It is not so, I have sickle cell for 1 year, for 2 years, and now okay. It is a lifelong thing. So you must accommodate that lifelong thing with them. We cannot say we won't give them jobs, we won't give them the opportunity to make money when they have a lifelong situation. So we are appealing at this time, please, in your employment space, create space for warriors. And we are equally appealing to the society. Let's stop the stigmatization. Let's stop the narrative. Sometimes I say everybody will not be a lover of warriors. But sometimes leave people the way they are. Don't increase their pains by your words. My younger sister, my mom had 4 of us as warriors. And you can imagine how the home will be. My youngest sister, she has stroke. And then it affected a part of her, the side of her. It makes her walking and her speech not to be as eloquent as we would have loved it to be. And someone looked at her and said, you walk like an imbecile. And you know, for years, these things talk more. If you tell her you don't walk like that, that one's talk more than you saying she doesn't look like it. Sometimes you say please and you walk away, but that person never forgets. They want to marry you against it. And I want to tell us as warriors, please add value to yourself. Go to school or learn hard work. Learn skills. No matter how small. My warriors, like I told you, I'm the founder of Pillar Sickle Cell Foundation. At every clinic, we have nothing less than 130 warriors in attendance. Why are they this many? They are this many because we intervene. We are in between the hospitals and the grassroots. How? We provide all their medications, including hydroxyurea, antibiotics, folic acid, and drink free of charge. Because we know one of the problems are with warriors. Now, the management is better for them. When you see where you are loved and you are spoken to, you would actually see them. And so we are appealing for warriors. Know yourself, know your limitation, know what works for you. And please don't ask for medications from people just randomly. My stomach is paining me, and the next person say, go and mix this and this and add it to water and turn it and drink it. Or they will tell, when my tummy was still paining me, this is what my doctor told me. What is the cause of your own tummy? What is the cause of that person? So please don't let us look for self-medication. It has killed a lot. And sincerely speaking, I'm so happy to be here. I'm happy that we are speaking about these things. Whether you are a warrior, or you are related to a warrior, or you are an healthcare provider, please, empathy is needed. You cannot wish them away. Know that this is not what they caused themselves. This is what would have been avoided. And we don't play the victim game. I really don't stand with anyone playing the victim. If my parents are not married, I will not be there. You are here already. So let's just face it. But then, when we are here already, please let's learn to support. I'm not saying spoil them, support them. Even if you can empower a warrior, this is what we are appealing for now. If you can empower a warrior, please do. Even if it is for sewing, for shoemaking, and there are a lot of things going online now. If you can introduce where they make legit source of income, please do. Make up your, let June 19 not be a day we just come, we just talk about it, and we just go, and we are still where we are. Make up your mind that I will help a warrior. Even if you can buy folic acid for a warrior in a month, I think it's about 400 naira. I know many of us can dash out that 500 naira, 400 naira. Just make up your mind to say, a warrior, I will give this. This is how we move Sickle Cell Day forward. The talk without us doing action is actually just an event. So I want us to just put action, whether you are, even if you are a warrior doing well, thriving well, I want us to move from the level of a sickler. Sickler has become weaponized. Why they work like say you be sick? It's like it's become like a word of abuse. Don't let us weaponize it. If you can help in any way, help. If you can give 100, 5,000, 2,000 to a foundation you know is thriving, this is a foundation, I think. You give out. Help me reach out to 2 warriors with 4 folic acid. You have done something. This is what God wants. Be it in the Bible, be it in the Quran. God supports this. The needy will not vanish away. The sick will not vanish. We must reach out to them. That is your service to humanity. That is what we are bound to do in heaven. Doing as if they are not existing abounds to no one. It will abound to you not just on earth, but in heaven. Reach out to that person you know you can reach out to. And for every sickle cell warrior, please, sickle cell is not a death sentence. The number of scars you have shows how many battles you have won. Count it. If I begin to count what I've gone through, I see that I've gone through this, I've gone through this, I've gone through that. I know I have actually won many battles. I call myself a winner, a champion. And that is the story that every sickle cell warrior should aspire to. Go beyond warrior to someone that is thriving. That is just the truth. Encourage yourself. It comes to a time in the life of a person, you are the only one that can speak to yourself. Life moved on without me at a point in time. Until today, sincerely speaking, I've not been able to move past to say, this friend that I have, let's continue the friendship. Because I felt, wow, for 2 years I was indoors. And I didn't even, you know, when you have phone and you are looking at your phone, it's not ringing a whole day, 2 days. You know, there's this thing that happens. This thinking within your heart. You don't past it. But I don't have anybody I in my mind. I am very free. And now that is why my passion, sincerely speaking, I can talk about sickle cell. I can be with warriors 4/2/4/7. I'll just be drinking my water and be eating. When I'm in the clinic, or sickle cell clinic thing, you know, sit there and talk, we eat, we do all. It has become my life. At 52, I bless God. God has helped me. God has given me a good man that gives me good support. Family support, and without family support, sincerely speaking, is difficult. We are encouraging families. Please love your warriors. Even the children, don't say, don't go there, don't drink, don't play ball, don't do this. Tell them why. If I'm telling somebody, they brought a small warrior. I don't want to take Andrew. They say I should be taking Androxyl and folic acid. The day I told him, because he has had a stroke at the age of 7, and I had to tell him, this is why you take hydroxyl. This is in fact, I took rope, I started doing demonstration. By the time we finished, every day, I asked, Mommy, do you want me to have another stroke? You won't give me. It takes it. Tell them the why. Teach your children the why. Teach them to look at the color of their urine and report back to you. Don't go and be looking at it yourself. My mom didn't live too long because of the stress of 4 warriors. You need to take care of yourself as you take care of warriors. By the grace of God, we are winners. God is involved. God is involved. There's no limitation unless the one you draw for yourself. By the grace of God, we are marching forward even in this fight. By the grace of God, in Jesus' name. Amen. Thank you very much.
Let's put our hands together again for her. One thing that stands out for me is when she said self-care, self-love. Like, sometimes you have to love yourself because nobody is going to love you better. It can look vain. It can look as vain as looking at yourself and say, damn, okay, fine. Just do that to yourself. Like, when you expect from others what you don't give to yourself, sometimes you get disappointed. So we must love ourselves first. We must start from within. We must start from them. So the awareness we're talking about today is not just going to start from someone else. You cannot expect it from someone else. It must start from us. It must start from you. It must start right there where you are. Somebody said, if not now, when? If not you, who? So who else is going to do that? So we must learn to love ourselves. We must learn to take care of ourselves. Even before health practitioners do, take care of yourself, love yourself. So the next on our list is going to be a lecture on understanding sickle cell disease, which is going to come from Dr. Ovie Ewuga, a consultant hematologist from Federal Medical Center, Kefi. Please let's put our hands together for him. Thank you, sir.
Morning, Choso. Morning. It's good to be here. Big warriors, don't answer me. You know, I've loved the organizers have invited parents to be here too. That made it much more better. You see some warriors, some few visions of warriors. That's fine. So, oh, beautiful. You know, I just finished my training this morning before I came here. And Kuba, you know, he says about football. For you. So there's this little boy of about 10 years old who came to see his mother, and then his elder brother. And then I said, and I mean, what do you want to be? He said, I want to be a footballer. I said, footballer? He said, what for you? When you go to play ball, trouble starts with the beating. Yeah, I said, don't you understand? You go to play and stuff. Go and pick what you want to do. And I looked at him and the other brother. I told the brother, that me is stronger than you. And he was like, yeah, it's a warrior. I said, scars and pains gone through can't be reduced. And then Our auntie here is 52-year-old. I have a patient I just spoke to because about the patient went out to my residence. She's only between 54 this year.
Yes,
She went into crisis some 2 weeks ago. I was just asleep. 5 a.m. in the morning, I was home because of this. And
Yes,
you know, for the warrior, you know, wouldn't call you a good thing.
yes, it is.
Call you. It's so bad. And it's been a while I saw her.
I think so.
And so I was like, do you have secret type of pen? He said yes. And she started pushing to go to the toilet, came out. So associate. She doesn't want to go to church. So who will see us? Go there, now speak with them. It's on duty. And then a private facility, you know, it's like, you don't have specialists there. Do you have the entire to see the house? Yes. Is there anybody that has a beautiful? So 5 p.m. Dashed from the house. At midnight, in a whole room there.
I don't know.
And then she had, you know, the pain went through for about 3-4 days.
It's on presently as we're speaking.
This particular woman is a director in the state ministry. She was appointed a permanent secretary 2 years ago. So when the present administration came, pushed him again in line with what she said, get to this limit of the chosen career. No one should discourage you. While we're medical students, we had 4 warriors in our class. Some of them, you don't even know their secrets. We lost one immediately after graduation. Again, the knowledge of a secret wasn't really much. And then 3 of them pulled through. The 3 of them became consultants. We lost one last year at the age of 50. Again, I think it was a 3 kids. We lost him, he was married with 3 children. He was working for the NGO. He was public. So, self-love. We must love ourselves first. So passionate about sickle cell patients. To me, my doctor will tell you, not to try to get my anger, then you do it. Because once you're called to see patients who is in crisis, and you don't come, and you should, you must be there. You don't have a choice. When I was in my residency, a young man came for residency training. He's in Abuja here. When I saw him, yellowish eyes, you know, again, how are you? Sickle cell patient, he said yes. But one thing stands out, you guys are quite intelligent. Sharp. And then each time he comes around, I'm very stubborn again. So when he comes to the hospital, I notice being listening around. So I come here. Are you okay? Chief, I'm fine. So no. Oh yeah. Call the wife and tell her I'm between here. So how you won't go. Get her out, get the couch. Wait. Don't tell her the big today is a consultant hematologist here in Abuja. Works with Garki Hospital. Very, very intelligent. He's so passionate. So can get to anywhere to get to. If God knocks, we get to what we're supposed to get. Thank you very much. So my name is Obe Iruga. I work with Federal Medical Center in Kefi here in Nasarawa State. The last 17 years, I've been doing this job of taking care of sickle cell patients. Which I went through my residence training. So, being a specialist. For about 20 years, I've been managing as a medical doctor. So it's something I love doing so much. You know, I didn't already give a lecture to when yesterday night. Okay, so we shall delve some of the jargons. You see them, let us explain. So, understanding sickle cell disease, medical insight and advances. That's how many slides. Next slide. So, what is sickle cell disease? Sickle cell anemia? What is sickle cell trait? What is the burden of sickle cell disease? How many people have sickle cell disease? How is sickle cell disease transmitted? How do people with sickle cell disease present? What are the complications of sickle cell disease? Is there a cure? Etc. Moving. Sickle cell anemia is an inherited disorder of hemoglobin, which an individual inherits two abnormal hemoglobin genes. Now, the word is sickle cell anemia, not sickle cell disease. So you inherit two abnormal hemoglobin genes. Both of them not with the SS. Okay? That's what we call them what? SS. The two genes are abnormal. Both of them are the SS gene. Sickle cell disease. Two of the genes are abnormal. One of them is an S gene. One could be a D, an E, or a C. Do you understand? Sickle cell disease. The slide, next one. Now, sickle cell trait. AS. The slide this is right. Definition. Okay. Again, so SAS present with symptoms. Okay. It's not really common. Like what we have in the SS, the SC, the SD, and the SP. Okay. We're not moving. Okay. You know, when she was giving us self-love, I had a patient some years ago. I asked her a question. Do you have a boyfriend? To get to a point. Say, beautiful young lady, and no two sons are coming around. The moment they come around, oh, Sickle. One run away, I see she be a leper. Again, it becomes discouraged. I said, what? You're trying to get married? I don't you okay? No, no, no. I don't want to report to anyone. She started with this language. Then all the from everything. Making a massive degree. I lost time. So, the quality jobs was so much, problems came on. And I said, why? I have to make money for myself. I can take care of myself. And no man will tell me rubbish in my house. And she said, her father said something to her. What did he tell you? All those times she was in crisis. I was quite tired of you. You know, I love the line, issues came up with the family. She has an elder sister. It was always my case. And then I was at home one day, she called me, Dr. Yoga, I'm going to take my sister to the police station. What happened? Anything happens to me, you're responsible. You told your parents, must listen to me. So I had to call the mother. mend your relationship with your daughter. Yes, it's not easy. You've done your best. You're trying to words from our mouths. We lead its people to commit suicide. The thing we lost, what I call about 4 a.m. was around 5 a.m. And the other stuff was fighting. Kept fitting. But when she came back to life, she was happy she made peace with her sister. So you must love yourself. You must do one or two things that will make you get your own money. Do you understand? That's the first night. Fine. What? Okay. First night. Fine. Okay. Take it back. Ready to give up. It takes time again. Well, this is the story of Sickle Cell Disease. 1910, there was a physician named James Harry who discovered this disease. Okay? He noticed that the cells in blood that we see. Okay? For the sickle, you look like the sickle, you use a bacterial everything. Yeah. So that's the history of this 1910. Okay? Next slide, please. Cells. Ideally, the red blood cells are concave in nature, round, and so they tend to transfer through the blood vessels without any hindrance. Okay? They pass through the blood vessels seamlessly. But when they become sick, they tend to stick to each other. So, that's becomes so narrow. So whatever happens from this pathogenesis is what pains you feel in every structure of your body. Okay? So the complication we tend to have at the as a result of cell being produced by the body. And there's a mutation. Okay? In hemoglobin, an exchange. Okay, writing for Chinese. That's what is sickle cells. Let's go. So this is a normal sickle cell, okay? Inside of some are normal red blood cell and then the sickle cell. Next slide. This is what I'm just explaining. Passage. Normal cells move freely, but sickle cells just talk to each other. So assuming there's a bone here that's supposed to supply by this blood vessel, there's a limitation to the flow of blood. That's why you have the pain, you have the fat, you have the necrosis. Okay? In the brain, then you have a stroke. Is that okay? Kidneys, comes up with kidney failure. Is that okay? So it's more of an African disease. African disease. So you can see there. It's purely an African disease. So more than 2.5 million Americans, 70,000 or more Americans have sickle cell disease. But 1,000 babies at the moment. It's Nigeria, 1/3 of the population gets 5,000 to 90,000 babies. So it's recorded in Nigeria. Okay? So again, it's recorded in America. The Nigerian story. So December 2005, each year, 200,000 people are born in Africa. It's major diabetes, out of which are 300,000. So there's a prevalence, okay, of sickle cell which has said that Nigeria has the highest rate, 5%. And you know why? Put it here now. You live in miracles. None of you. We don't do tests. But here, even in Islam now, it's not. My pastor said something to me. He said, the first do the genotype and even the chemistry. Get it from the top. Next slide. So I explain to you. Okay, that is sticking across cells, the sickle cell. These are all symptoms you tend to have. Okay, as a sickle cell patient. So the loss were affected to the kidneys, the bones, the brain. That was true. It's like so normally the red cells take 120 years. Okay? For the identification of a sickle cell patient. 10 to 20 or 30 years. That's why I want to see from okay? I'll join this for the cells. So this is what happens. This oxygen is what happens. And there's no oxygen. It's deposited because on top of here, 10 to 1. It's like this is the order of inheritance. Most of the time, the problem we have sorry, what them now you see about 25% chances. The roadside doctor said, nothing will happen. You're going to give birth to 4 children. That is 3. They have 1. A lot of people have gone to that one because they don't have it. But what we're saying here now, every pregnancy, chances there. And since we have just to do something about 4 of you, right? That patient is just also 4. We lost 2 of them. So at the point when they come out, you take the private route, the 3 of them, and the mother takes from one room to the the husband is a professor in his area, doesn't know what's happening. And that's why I say women have to see the things. No punishment tell you love, love, love. Love has twice.
I want to tell you I'll be there about your wedding. And then along the line, I was going to church one morning and she called me, she was crying. Like, what's the matter now? The man says he's not doing it again. Just like your own experience. Now, the mother and the father of the boy, I mean the man, he's a boy, not a man, because the boy couldn't make decision for himself. They said, you want to carry this trouble, that this is contagious. You know, I was like, contagious, how now? And then the boy said, he has to follow his mother's wish. He's not doing. Then I should speak to his friend. And I asked the boy, are you the one, okay, where do you stay? He stays in his parents' house. So if you marry this girl, now where will you stay? He kept quiet. I said, you're not serious yet. And I told the girl, forget about him. But of course, these are things that we don't want to hear. But I said, the right man will come for you. Forget about him and move on to your life. And do you know when he got married? He said, come back to the girl again. Maka, why now? I said, no, you don't have anything to do with him. You should go and face his family. Since he refused in the first instance to marry you now, what does he want with you again? So we get to a point of desperation that we feel, I'm getting old. No one will come. That right man will come for you. The man that will love you and cherish you. What I usually do in the clinic is that when a young lady comes to me, my patient that wants to get married, I ask to see the man that wants to marry her. We'll talk. We'll talk quietly, and then I'll give you warning even. If you're not prepared, don't even start it. The thing is that, have you seen her in crisis? If you've not seen, wait and see her in crisis first. Yes, because you've not seen her, you're branding love all over the whole place. And when the trouble comes, you can't stand. The last one I spoke with, she was in crisis in the hospital. And I said, you said you want to marry? He said, yes, sir. I said, where's your boyfriend? There's not around. You came here 2 days ago, and the boy has not come. I said, mind yourself. I called the mother and her auntie. I said, I'm warning you people, don't push again to this marriage. Because a man that wants to marry you, you've been here for 2 days in crisis, and one has no show that his father is not well. He's taking care of his father. I said, she continue that one now. I met her in one of my sister's house. I said, have you got to marry? No, sir. I said, better for you. Because that kind of man will end up killing you in the house. He will add more trouble for you. Again, your psyche matters a lot. It matters because that's what will keep you moving. You need to be strong. So, this is a pattern. We all know how we inherited the disease condition. No, he said, blaming. But that was what happened. It's for us now to take this gospel out now and tell the people out there, this is real and this is what happened. Next slide, please. The same thing here, please. Next slide. So, it's about the trait now. Okay? Told us some might have crisis when there's less oxygen tension. Okay? They have minor kidney problems. But again, the crisis is about maybe 4% of those who are carriers. Next slide. So, I have defined what sickle cell anemia is to you. Next slide. I told you we have the HbC, that's the hemoglobin C, combination with the SC, okay? And then we have what we call the S-beta thalassemia. They are what we call the hemoglobinopathies. It's a group of disease now that the sickle cell disease, sickle cell anemia falls into. Next slide. Next slide. So, the map of Africa, sickle cell, malaria endemic area now, okay? And we know malaria, that's why you take your Paladril, is that not so? Prevent you from coming down with malaria. We must have our nets on our beds, our windows, or flit our rooms. Next slide. So, it's all about the cell mutation that occurs, okay, in sickle cell patients. We don't want to bug you with all these long grammar. Next slide. So, the screening test. You call it a genotype, we call it hemoglobin electrophoresis. Yeah, you talk about genotype, you talk about a kind of genetic testing. So we call it electrophoresis. Okay? So you take the blood sample. Those are at risk you do during pregnancy. You can do it during the prenatal testing period. But again, some of the errors again we make, someone was telling me some days back that if you marry a 12 us AS, when I'm pregnant, we can go and do prenatal testing. So if the fetus there is an SS, what do you do? You abort it. Tomorrow, you abort it. Remember in Nigeria, abortion is illegal. So that is what, women can be very crafty. You want a woman. So they keep telling you that. Now, even to run the test, with this economic situation we have in Nigeria now, do you have the money to go and run the test? And the man tells you, don't worry, when you check in, we'll go and run the test. And then if it is SS now, we abort it. Tomorrow, SS we abort. So how many will you abort? Do you understand? So that is a pre-testing chronic value sampling, okay, that you do when a woman is pregnant. Next slide, please. You can see the sickle cells up there. So the early symptoms, she said, he said at 5, that was when he was diagnosed with sickle cell patient. The majority of people from about 6 months of age, when the fetal hemoglobin started wearing off, okay, being replaced by the what? The adult hemoglobin. Is that okay? Now, for people, there are some people that might maybe 10 years or more than 10 years before they be diagnosed with sickle cell patient is because of a persistence of the fetal hemoglobin. And that's why you take your hydroxyurea, because it tends to produce the fetal hemoglobin. Is that okay? Yes. So the hand and foot syndrome, that's painful hand and foot syndrome, jaundice. You know, a child cannot even talk. A child about 6, just be crying. You see that the hands are swollen, the foot are swollen. Okay, you might see jaundice, anemia. Okay, so these are the presentations. Okay, of a child. Okay, when the crisis starts. Next slide. So you can see it now. It's fatigue due to anemia. The joint is there. The red cells have been broken down. Breathlessness, anemia too. The back pain, the hand swelling, the arm and legs pain, the joint pain, and the foot swelling. All these are the result of the sickle cells that have blocked the blood vessels and allow free flow of blood and then oxygen being transported to various tissues and organs of the body. Okay? Next slide. So, these are medical complications. The pain episodes are what we call the crisis. Okay? We have the vaso-occlusive crisis, we have a sequestration crisis, hemolytic crisis, and which of the crises again do you know? A plastic crisis. And we manage them differently. But the common one we have is the VOC. That's the pain you have all over. Vaso-occlusive crisis. You can have stroke, increased infections. So why do you have infections? Why? Any worry here? Apart from mommy. She has enough information with you. Mm-hmm. Why do you have infections? Oh, really? Okay. Wait again. Yeah. Why do you have infections? Recurrent? What you tell me? Yeah, tell us. Kobira.
Because our white blood cells are low.
Not really.
And that's immune system in general.
That's one, but why?
As the red blood cells are breaking down, the white blood cells are increasing. And then
Now, the spleen of the sickle cell patient is atrophied. So the immune system is down because you don't have a spleen. Yes. From infarction, okay, it tends to like the size reduces. So by the time we scan all of you now, we just know some rudiment of the spleen, which is not functional. And so the immune system goes down. Okay? Yes, that's why. Bone damage. You talked about being in a wheelchair for some time. Avascular necrosis. Okay, childbirth. Okay. Again, AVN, like complication of sickle cell. Again, lack of blood supply to the femur. Talk about leg ulcers, ma? Good. Chronic leg ulcers. Again, it's quite difficult to treat. Very. How long did it take yours? Good. And then even if you want to do a plastic surgery, sometimes the graft doesn't even accept it. So we keep pressing. They become nurses and doctors on their own even because they've learned the act of pressing the ulcers. Okay? Gallstones, lung blockage, priapism. Okay? The males, you have painful, purposeless erection of a penis. There's not, due to sexual arousal. And might last for some minutes up to about hours. And when nothing is done about that, then we have a problem. Erectile dysfunction, impotence, okay, and then disfiguration of the penis. So when anybody has priapism, patient should rush to the hospital, it will handle there. It's still longer than necessary, then there's a problem. May end up not being able to use it again. And then you want to go and marry one sister now. You say, no, not now, to marry now. And when you marry now, it's time for prayer. Do you understand? Say we are praying, we are fasting. Why are you disturbing me? At that point, you get so angry because your ego has been bruised, and then trouble starts for you in the house again. Is that okay? Next slide, please. So we talked about infections. I told about splenic secretion. Okay. So in splenic secretion, it's a form of crisis now, in which blood is being pulled to that little spleen that you have, and you find that it becomes enlarged. Now, if that's not being handled again, you're going into shock. Sometimes it goes to the liver. Okay? The same blood pulls to the liver, form of crisis. So we have to manage it, transfusion, keep measuring the organs to be sure that this blood has been pulled out in from the spleen. Okay? Fine. So you have a plastic crisis again. That one, the bone marrow is not producing anything. You have to support the bone marrow again. Is that okay? Next slide, please. Stroke. I told about stroke initially, earlier on, when the blood supply is limited, mostly children between the ages of 2 to 16, stroke comes. Okay, so we have to monitor them with what? Doppler ultrasound. Check the velocity. Okay, and if it's more than 200, what do we do now? We have to manage by giving hypertransfusion, blood transfusion to help them. Okay, it's a very sorry sight to see them when they come with stroke. It's not pleasant at all. So bone diseases, osteomyelitis, might find, hands everywhere. Okay, also quite difficult to treat too. Okay, infection of the bone. Talk about AVN, okay, of the femur and the humerus. Okay, I told you the blood supply is being disrupted. There's no flow. That's why the place becomes necrotic, dead. And if you have to do a hip replacement, I don't know in Abuja here, but 2.something million. Am I right? The last one I sent one to Kano, we paid about 1.8 million just for one hip. Evian. More than Abuja? Okay, good. Fine. So you can imagine if you have to do for the two, how much will you spend? Then it means that we have to take care of ourselves. That it doesn't happen. Next slide. We talk about leg ulcers. We talk about the eye complications, mostly in patients who are hemoglobin SC. And the SC are found mostly in the western region of Nigeria, Yoruba people. Down to around the Benin, where you have borders with those Yoruba people. They don't also come with SC, so they tend to have regionopathy. Is that okay? Now, we talk about priapism. It's chronic anemia. And the bodies of sickle cell patients tend to thrive with the chronic anemia. So if you give me that kind of PCV, I can't handle it. I cannot. Because I'm used to my 40 to 50. But you see a sickle cell patient who has a steady state of 20 and moving around. Because the body has been able to adapt to that. The same day I told you about the director in Jos. She called last week. I was back to Abuja, and there was this generalized body weakness. So we did have PCV. When I saw her, it was about 28%, 27%. And when she was talking about weaknesses, I said, okay, fine, we're going to repeat the PCV again. And it turned to be 26. I was like, okay, fine. Try to eat well and let's see what happens. And then as of 3 days ago, 2 days ago, it turned out to be 25%. So it was about 3% lower than her steady state. And I was uncomfortable with that. If you don't intervene now, we have what? Heart failure and setting. Might not be too good for her. I'm going to transfuse you. Oh, I've never been transfused before. I said, no, you don't have a choice. I will do that. To pull you out from where you are, but you to be comfortable. So she got a pint of blood 2 days ago. Now, when you go to her house, there's a staircase. When she was climbing, she had to rest. So I called her before I came. She went to repeat the PCV. She not gotten back to me. But she was able to climb the staircase comfortably yesterday and the day before yesterday. And people were like, is it just climbing this thing with speed? 2 days ago, you couldn't climb this thing. And now you're comfortable now. Okay? So there's what we call the steady state PCV. And that's the PCV in which the individual can operate optimally without any compromise. So for every warrior, you must know your steady state PCV. Because you might find yourself somewhere. Say, hey, we have transfuser. No. This is my steady state PCV. I'm okay with it. Do you understand me? You know, when you go to these are small hospitals, they rush to do that for you. Yes. And that's my quarrel with them most of the time. They rush to transfuse you when you don't even need transfusion. You know, before you transfuse sickle cell disease, you must have a very strong indication. There must be a reason why you have to do that. Otherwise, allow the person be. Person is going to failure, you intervene. Priapism, you intervene. Sequestration, intervene. Tension stroke, intervene. Otherwise, they are okay with their chronic anemia and let them be like that. Okay? Next slide. Next slide. So, danger signs of crisis. I'm sure most of the warriors have gone through this. Am I right? Most of us have gone through this. So it means that there's trouble and we need to do something. And one thing, as she said, I don't like my patients going to the chemist. It gets me angry. It irritates me. I will tell them, come in the middle of the night, I'm there. If I'm not, someone must be there to see you. The mind the chemist, as she said, will make something for you. When the trouble is what he doesn't even know. The patient might need transfusion. You don't know. There might be sepsis. You don't know. And you know, if you don't remove the cause of the crisis, no. So I get so angry. I don't want to hear that you went to the chemist. There's somebody on call that must see you. My phones are open 24 hours to pick up your call, tell you what to do. You can go there. Something we have to do in the house, we'll do by tomorrow morning. Find your way to the hospital. So please, chemist, Mbanu. That's not your place. Hospital. And let's try to find a place where there's a specialist that can handle your matter. Because for me, I feel it's not every doctor that can handle them. Yes. We see them even in where we work. It's not every doctor. Do you understand? You know, she said, some people don't understand what you go through. You know, I keep saying something. The only pain you can be able to quantify that is close to that sickle cell pain is what, ma? Childbirth. Childbirth is even better. Because it will come and go. But this one is a bone and keeps, keeps moving. Do you understand? So if you're a mother here, you've delivered vaginally, you can just imagine what these people are going through. When I was doing general doctor work, and when I see women, pushing, I've delivered women vaginally even through CS. No, it's not a funny experience. And for me, it was like, well, normal thing, come, let's do it, we'll finish it. But there was the level of my own wife. Men, it was hell. I said, madam, no more. I know do. Because you see life coming out after that woman. It's not, no. And then you can imagine what she is going through when pain starts. And you can imagine pain for 1 week. Abba. So it's not, you can't just explain it. You can just say, sorry. That's your sorry. But they say, my bag, and you do it. Just the pampered small. But you cannot do anything about it. No matter what you try to do. No. Next slide. So when you have those symptoms, you seek for urgent care. Attention, you go to the hospital, please. So these are the crises. We talk about the crisis, okay? Pain in the fingers, the arms, the joint, the legs, abdomen, pain, So these are the VOCs, the vaso-occlusive crisis. Okay? Now we have what we call the acute chest syndrome, which is a very severe complication now. If not handled properly, could lead to the death of the patient. When there's decreased oxygen entry into the lungs, and then the sickle cells are infiltrated to the lungs. Okay? There's breathlessness, there's fever. Okay? If that's not handled properly, you might end up losing the person. Okay? Next slide. So these are triggers now. Okay? These are triggers. So it means that we have to be careful. We talk about football. When you go play football, you over-exert yourself. Okay? The oxygen flow reduces, and then we have crisis. So you can, maybe when you go to the hospital, you hear us asking you some questions around this. You need to know what really trigger the VOC. So we try to pull it out. Sometimes again, emotions, when you're stressed up, there's a heartbreak. Your boyfriend or your girlfriend disappoints you. You get so worried again. We enter trouble again then. Okay? We have to guard our hearts again. Next slide. So, predicting pain now. So you have a child. She said something about check. You did it. Asking your child the color of his urine. You did it, asking the child about the color of his urine. Fine. So you can see. Test. The eyes turn yellow. Join this. The urine too turns yellow. Means the child is dehydrated. Becomes irritable or tired. So when you have this, of course, there's a problem. We have to act again. Next slide. So yes, most of us tend to do these things when we're in pain. Is that not so? You get your warm water bath and hot water bath bottle, Abby, tend to compress there to increase the flow of blood. Okay. Next slide. So, folic acid, palodril, we have Adjuria now. Okay. In Nigeria, we are not too particular about penicillin injection. Have you had it before, ma? They're not too particular, and because of the epidemic nature of the sickle cell patient, try to boost the immune system. That's why they give penicillin. They do it on the other side. Okay. So you get plenty of rest. She talked about it. Then she said most things I wanted to say in this place now. When she wants to rest, she rests a lot. You understand? When you want to walk, you walk. But when you feel the aura now, you pull back and what? And rest. You don't continue. If you do that, you break down again. Is that okay? Plenty of water. Advocate 3 liters to 4 liters in a day. Okay? We do that, you hydrate yourself properly. When the weather is so hot, even, you won't ask for more. Do you understand? So we have to teach our children, teach our siblings, drink water. Some parents, they buy a bottled water now that's been calibrated. You pour water for the child to go to school with. They would finish, you tell the child add more water for inside the bottle. Keeps drinking. Like the young one I saw today, he's been free from Christ for about 2 years now. No crisis. Before they had these tonsils, and tonsils were like the focus of the crisis. So I said, we're going to do tonsils. And then he's there from Kogi here. Kogi. You know Nigerians, but just believe we too much. And then the father and the mother were both heirs, so they had to get divorced after the first child died, and then this boy now. So they separated, got divorced, and then the stepmother was with me. I never knew she was a stepmother. You know, I never knew because you could see the bonding between the two of them. They said, doctor, Alami is not my son. I said, it's not your son, how now? They say, I have to call his mother first for her to give her consent before the surgery. The father matter, sometimes people also run away from blame. If something happens, I say, you consented to it. Then she came and please call, so I can talk to my mother. No, in my place, we don't do that. They did that for someone, the person died. I said, madam, if we don't remove this thing, this boy will keep coming to the hospital. The VOC will persist. And then she will come. So we admitted for the first time. And then we couldn't get the surgery done that week. But since we did the surgery 3 years ago, up to this moment, there's not been crisis. Very fine. Boy is doing very well. Very handsome young man. You know. So next slide, please. So treating the complications. What we do is that you manage the pains, manage hydration, and then you manage infection. So three things we do for our sickle cell patients. Okay. So we give you a drip. But do you have people in your place? Okay, you just cancel them. Just in the clinic. Where's the place? Inside. When do you run your clinic? Okay, maybe send me. I'll visit there one of these days to see what you're doing. Fine. So when I meet you, you know the thing is about the pain is that you give the analgesic generously. You don't mize it. Because you cannot stand the pain. You don't mize it. So now I went to give that my friend, that my patient. She was saw me breaking 3 of pentazocine. It's not too much. That's what you own now. It's going to manage this pain for you because she was, it was so excruciating. So when I gave her the 90, she went off. So I said, I will start now. So set up a life for her, and then started managing her. So most of the time, you try to know which one works for you better. Which one analgesics. But the fear of addiction. Because most of the warriors, when they're used to it, it gives this kind of high feeling. Begin to abuse it. And we've come to realize that the pharmacy, the chemist they go to buy will never, let's say it's 10 naira, they sell for 100 naira. And then the patient will never divulge information where I got the drug from. For fear of it's a controlled drug. So you can imagine a warrior taking 10 in the day or more than 10. So when you look at them, ulcers. A friend of mine, she turned 50 last year. Right here, around her breast here, she injects herself. So, and all her money finishes there. And it's sad. So I told you earlier on, we transfuse only when it's necessary. You don't just give blood. Blood has its own complications even. Is it the infections? Is it the load of iron? A lot of problems. So you only transfuse when it's necessary for you to transfuse such people. Okay? Next slide. So somebody want to talk about that, right? You? Yes, fine. So these are issues. So when you come to talk about them. Next slide. The same thing. Next slide. Next. Good. We talked about hydroxyurea, and I told the mechanism in which it works. Production of fetal hemoglobin. So what we usually do, when you run your test, we try to look at the quantity of the fetal hemoglobin. to see the level. And then we introduce it hydroxyurea. After a while, we look at it again to see how much of the hemoglobin have you been able to gain. We expect that the PCV will be elevated, okay, based on the drug you're taking. Remember, the drug is used to treat cancers, but the beneficial effect of it is what we are using now. I think from research, there's no adverse effect that has been registered with it. I think only for maybe darkening of the nail beds, the palms. Okay, but apart from that, I don't know. And then for a patient who has been having frequent crisis, is a candidate for hydroxyurea. So if you have someone that maybe doesn't have crisis, maybe once in 3 years, 4 years, you allow him be. Okay? Yeah, the drug is quite expensive. How much is that, man? A pack. Good. Understand? So you're doing a good job, giving them free of charge. You know, when they don't have the drug, it's a problem. Next slide. Bone marrow transplant. Okay. Trying to what? To change the genetics of the patient. We have what we call the stem cell transplantation. We do a stem cell. Okay. The patient is free from the symptoms, but the patient can be able to transmit the disease. So again, the patient should not go and marry an AS or an SS. Symptoms free. Okay. Next slide. That's the ultimate cure. Gene therapy. Okay. Next slide. So mutual respect, trust, and confidence. That's what everyone expects from me as a doctor and every caregiver. For us to make their life pain-free, we have to give them all this and give them love. Next slide. That should be also. Next slide. So in our environment, that's what's expected to be done. Okay? But as you said, you ask people, I don't know my genotype. They say, I'm O positive, I'm O negative. Next slide. Next slide. Next slide. Go ahead. Go on. Next slide. So this is a chronic leg ulcer. Okay? That's the way it is. Next slide. This is a painful swollen hand syndrome. Okay. Next slide. And this is an avian. Okay. Avascular necrosis of the head of the femur. Next slide. These are sickle cells. You can see them there. Next slide. Next slide. That's priapism. Okay. Painful erection of the penis. Okay. Next slide. We can have a few full of children to enjoy our lives with when we do the needful. Okay. In my opinion, you don't say don't marry yourself because they say infringing on their fundamental human right. But by the time we do the needful, we reduce the burden of the disease. We get to a point that we face the disease out of our own community. Okay. Next slide. And then we save our money from buying drugs. Thank you very much.
Thank you very much. Thank you, sir. Please let's put our hands together for him. So before we go ahead, I heard plenty medical jargon. I don't know if I'm the only one that heard. Kobe, did you hear anything? Because when I ask questions, people should be ready. So the first question I'm going to ask is, how many people have done their hemoglobin electrophoresis? If you've done your hemoglobin, not you. Have you done yours? Yes, you raise your hand. Yes. So what's the result? What's the result? Yes. I just wanted to get somebody to say something very funny because when you ask that kind of questions,
normally people will just look at you weird. So it's just the same thing as your genotype test. So that's one thing I got. So being aware also makes us to learn more, have a better understanding. So this is one of the good things that we are here today to experience all this, to have all this, and to listen. So next on our list is a lecture on mental health. On mental health. So before we go, there was this something about warriors that I know. Like there's a character trait I know about them, and one of which is they're usually very persistent. They have this endurance, like endurance being top notch. So for every warrior I know, please let's put our hands together for them. Let's encourage them. Let's put our hands because they are warriors, they are fighters, they are people who linger. So we're going to have this lecture on mental health and emotional well-being by Peter Oyebola, who is a clinical psychologist at Lead Clinical Psychologist at Azela Services. Please let's put our hands together for him. He's the lead clinical psychologist. Welcome, sir.
Okay, so good afternoon, everyone. My name is Peter, and I'm happy to be here, and I'm also very grateful to the organizer for inviting me. So I can share some insights and also contribute a few things on how we can also support these our warriors and how to make their life better. So like it's been announced, I'm a clinical psychologist and I work in a setting. I work in neuropsychiatry hospital. So I work in a setting where some of the people I see, I see them because of some of the psychosocial complications that come from living with sickle cell anemia. So I'm going to be sharing. They said lecture. I was asking if I was going to make it I'll call it a talk, right? So I'm going to be sharing some maybe useful tips on what can also make it easier for us to live. So for us clinical psychologists, really the goal for us is different, right? And we all say that there's a difference between pain and suffering, right? So someone can have pain and not be suffering. So the goal is, I mean, that's the goal. So like just let's try to just limit just the pain and not the suffering. I know that when it comes to managing sickle cell, the emphasis usually is on the biological model that's talking about what the doctor do, managing pains, the crisis and all the likes of some of these things, and then there is little or not so much emphasis is placed on the psychosocial issues that come from some of these living with sickle cell, and those are some of the things that we're talking about today. Mrs. Josephine has talked a lot about many of those other things, many of them. And well, maybe I'll just touch on some few things and then conclude by how can we support. So let's just look at it from this way. So someone is born, and then it gets to a particular point when the person realizes that, oh, I have sickle cell anemia, and then he wants to play football, right? But then he soon realized that if I play football, right, I might just end up, in crisis. And then he's beginning to see some of the things that, he cannot do. And then maybe he's comparing himself to other people. At school, there are times when he's not feeling fine. Maybe he cannot even go to school, he missed 1 or 2 days in school. And people are asking questions around him, the friends, what's going on? So they begin to see that it's like he's weak, or this person is weak. So, that individual is. This is the beginning, the origin of when we say, oh, the discrimination, right? And then again, to the stigma that we virtually see. The person, finish up school and then is working. And then, I'm happy she spoke about some of those, the stigma, because it's actually very, very real. And okay, so my colleague at work, one of my colleagues at work has sickle cell anemia. And I know that there are days where, oh, thank God, because I work in mental health, so we're more understanding. Maybe other settings might not be that understanding. In fact, I wanted him to come, but he's just recovering. He said he couldn't come. I mean, it will have been a very blessing to this gathering. So I understand, very, very well as, people that I work with, at the same time, some of the people that, we also manage. So when employers, when they see that, oh, this one, this one, it will be very, he will not be as productive as I want, And then again, so, these are some of those other things, the issues. There's so many. These are psychosocial issues that we're talking about. You want to marry. The person is like, there's a question in the person's mind. Like, if he knows, how will he see me? Would the family agree? How would they treat me? And again, to the person, you get to the point where the person is like childbirth, because they've heard so many things. So at the point of childbirth, a lot of people have, gone, what's going to happen? Right? How about the financial burden as well? These are things that, people do not focus so much, beyond just the pain and the complication. There are psychosocial issues that are real, that people face, right? And I am an advocate for what we call the biopsychosocial model that is integrated, where, like I told you, some of the people that come to us really, again, it starts. 1 out of 3 people, there was a study that was done in 2011 in Benin that says that 1 out of 3 people with sickle cell anemia, right, will have a depressive, we meet criteria, we have symptoms that meet the criteria for depression at one point in their lifetime. Do you understand? And it's actually very easy to see, because some of these things, they worry, there's a lot, right, that can actually make them. So when they come in like that, so I see them because of some of the and just imagine that someone comes in, right, and I see the person, like for maybe a relationship issues, the person doesn't know how to go about something, or I'm seeing because the person is depressed and all that. But why can't it be together? Why can't it be integrated together? I'm an advocate of this, that such that if you go to your general hospital, for example, right, the same way you see your doctors, right, you can also have, a qualified mentor. Because again, I say this a lot, even in as much as talking is very important, but there's also a skill in talking that really empowers people better, right? So you also see that individual, right, and then understand you in that light, because that's part of their training as well. Do you understand? Now, so let's look at this way. There are 2 ways by which people interface with people that have sickle cell anemia. One way, and the 2 ways, there could be some, issues. So the first part is when you have people who can be very, very irritable, like what she was when she was speaking earlier, where you have people who are always very condemning. They were like, is he using it just to get a favor, this and that and all. And then you have people who genuinely care, right? They see them, and then they empathize, and then they want to help them. But then the way they go about it again, so it's also stressful to these individuals, right? Now, so that's where we're going to. So the first part, let's talk about the people who actually care, and they want to help. But then in that process of, caring, they go a little bit overboard. We call it emotional over-involvement. Oh, he cannot do that, though. He cannot do it. What if he do it like this? It's going to, this can happen and all that. Right? while we understand that, there could be issues, right? They need to be very careful. But at the same time, too, we also need to also understand that, you know, these people are not deformed, right? It's not like they cannot, like some of my colleagues and some of the people I interface with, right? That sickle cell is like, this thing that like they cannot do anything, like as if like you cannot do it, you cannot go there, you cannot, right? I feel like there has to be like that balance, especially when there's no crisis. This person is actually very healthy, but you go do it so excessively. So that process of being too involved causes a lot of stress, right, for this individual. So that's, you think you are trying to help, but at the same time too, you're also causing some additional burden to the individual. I hope you are getting what I'm saying, right? So that's that one. Then we also have the other set of people where, of course, probably because of the the belief system. I mean, I think it is declining now anyway. But before, it used to be the thing when people attribute people having sickle cell to a lot of those spiritual thing, and then they react to them based on that knowledge. Oh, you this evil person, you've been sent to consume all our money, and then they react to them in that manner. Or they say, oh, I can't, are you not supposed to have gotten used to it by now? You are exaggerating the pain and, and all that. So I talk about emotional over-involvement. So you want to care, but you are doing it excessively that is now causing stress to the individual. But then this other one is also, we don't talk about, hostility. The way you react, the names you call them, oh, they are lazy, they are this and all that. Right? So it causes additional psychosocial, burden on them. And then criticism as well too. Right? I want to very fast about it because I know that Mrs. Josephine has talked about some of those other things. Right? So the criticism as well, right, is also like a burden. So the question is now that can we find a balance in as much as, we all want to support. But there's a better way by which we actually support, where we maintain that balance. Because the truth is just that you realize that the psychosocial issues, the way they feel. I think the doctor was talking about, how the emotion can actually trigger crisis at times, right? How they feel, the breakups, the support they get from people, how they also impact. Because again, like I said the goal for us as psychologists, to limit it to just the pain and then outside of the suffering, right? So, and that is also very, very important. So the community by which we try to, build, right, the support, for this individual, how do we go about it when we think we are trying to do the right thing? Are we actually, providing the quality help that these people really need? Okay. Now, one of the other things is that, we're talking about, self-love and all that. So what is that doing? It's actually promoting resilience, really. So when we say resilience is talking about a factor that, you're able to really deal with issues on the face of adversity, right? So it is very, very important that we as individuals, and I'm going to be very practical here. Sometimes, do you know that? Okay, so that's constant. Oh, what is wrong with you? Like that. Sometimes, they just want to know that you are available, right? You are not a doctor. You are not a doctor. But they want to know that, oh, this person is available. If I want to talk, I can meet this person and talk. This person understands me. This person is not going to judge me. Do you understand? So that support is huge, right? So I think that we should have this understanding. We should present ourselves as that, and then not that in the process of trying to help them, we will now become an additional burden, to these individuals, right? Now, I think many of us will agree that one of the most distressing things that people with sickle cell anemia, go through is the pain, right? the pain and all that, how we can actually be. Of course, there's a lot of things, but the pain is actually at the center. Now, there's a techniques we use as psychologists. The technical name is called somatic tracking. So it's a technique you use in managing pain. But again, care needs also to be taken here, because when the pain is severe, see your doctor. Do you understand? So it's not like it works for all of them, but when you say from moderate to mild pain, you can actually use these techniques to help you. Remember I said that for everything we're trying to do, right, this is purely physiological, right? But in terms of, how do we make it easier for people, right? So you can actually use this. So, okay, so let me just try to maybe we can do like a practical session, just to demonstrate what it's all about. Maybe not, but I just try to just demonstrate, what it is. So, can we just try to just scan our body for, for tension or pain? Just imagine that you have an invisible scanner, and then you're just scanning your body for whether there is any pain or ache. It could be because you have been sitting down for a while now, and then you're feeling pain somewhere. Can we do that just for a few seconds? Okay, are we? All right. Now, remember, this does not work for severe pain. You need to understand that. Okay, so where you feel that pain, right? I want you to, like a curious scientist, right? So I want you to notice that sensation. If actually you have pain, and then because I do this for, lots of people I see, and then, it's evidence-based, meaning that it actually works, so it's not just a suggestion. So notice the sensation you are feeling at that point, right? Notice the sensation you're feeling. Does it look like the pain is, probing? Does it look like the pain is, just vibrating and then circle around, right? Does it look like the pain is moving? Now, so while you are noticing this, I want to just try to just breathe in and slowly breathe out. Make sure that what you are breathing out is more than what you are taking in, right? I have a formula that I always say 4-4-6 anyway, but just for the sake of demonstration anyway. But make sure what you are breathing out is more than you are taking in. So while you are doing that, you notice that, do you feel a little bit of relief when you are breathing in or you are breathing out, right? You'll be able to know that, do you feel that way in there while you are doing that? So at the same time too, don't, look at the pain, right? Again, you're not trying to change the pain. You're not trying to make it go away, right? It's okay, right? Just allow it to be there. But you're just breathing in and then breathe out. It's more like the breathing is actually going in and out of that particular pain when you're having that, sensation within your body, right? At the same time too, your mindset is also very, very important. So what do you have about that the mindset you have about that pain? Do you have the mindset that that pain is never going to end, right? So you also need to also be able to readjust and realign your thinking in this line. This pain is there, but it's going to pass, right? It's going to pass. I have gone through several of this pain, and then, it came to an end, right? So the line, I'm just trying to show us, a demonstration of what it is. It's better done in therapy sessions though. So you do that, right? So we help you in that line to manage some of those pain that people with sickle cell anemia, go through. So, okay. So in summary, the support we show people is very, very important. The support we show these people who go through this stress is very, very important, right? But most importantly, the way we go about to show them that this support is even more important. Some of the things that we do, and we think that, we are helping, could also be causing more stress, to this individual. So understand it. And I will say this to, warriors, right? It's very, very important that because over time you'll have understood yourself, you know, what works for you, right? What does not work for you, right? So, and then again, so being able to also communicate that to people around you so that they also better understand you is very, very important, right? So, also again, too, you know, community also helps as well. So, I think that she has a community, right? Okay, so joining some of the joining community, you know, sharing experiences, you know, can also be a way by which so that you know that some of the things, you know, there could be a particular thing that I feel like is just, you know, it's just only you going through that particular thing. So you know, experiences, you know, so how they went about it, how they go about it, you know, can also be, you know, relieving for you. So what I'm trying to say is just that, you know, can we begin to talk about a system where we have an integration where, I mean, people do not have to see a doctor in one facility, right? And then they come to, because again, the truth is just that there are psychosocial issues that they just want people who are trained to handle that, you know, in a particular settings where, you know, their needs, you know, are actually met. So I think that's one thing that I feel like, you know, I want to just contribute to these days, you know, so that it can be like a comprehensive and integrated approach so that, you know, they are better helped rather than, you know, it's only when it's, or we're not trying to downplay one or and say this one is not as important as this other one. I just hope that, you know, we've been able to get a few things, you know, about how we can better support these people, right? How to help ourselves, and then, you know, promoting resilience, you know, how we can best achieve this, and then over time we are better off for it. Thank you very much.
Please let's put our hands together for him again. Thank you. Thank you, sir. So one of the things I got from this psychological class or teaching is, you know, in giving help, in showing empathy, we do not need to walk on eggshells around people with sickle cell. Like we do not need to be too careful for them. Do you get? We should be able to give them that accommodating feeling to be themselves. Like we don't need to be up in their face every time with it because they already have a lot of that. So one of the things he said is don't be too much. Yes, we'll show them love. Yes, we'll show them empathy. And let me tell you, some of them can be very, very stubborn, just like doctor said. So there's a way we'll go around it and not, you know, bust their bubble. There's a way we'll go around it and draw them out of themselves. Sometimes there are times where, in fact, if you look at them and they are not complying, shout. Shout. Kobiro is smiling. So you just need to shout at that point. So that's why these awareness we're having today is very important. So there's a place for empathy, there's a place for love, there's a place also for tough love when we need to go tough on them, and there's a place for us, you know, to let them be. Just let them be themselves. For that 7-year-old that wants to be a footballer, like it breaks my heart that he will be told that you cannot do what you want to do just because of your condition. But there's also a place where we can say, see, you can become a football analyst. In fact, you can become a coach. You can be something around it. You can do something around it and you can still live that your dream. So in as much as we're going to encourage them, we're also going to tell them the truth. So the next on our list, we're going to, as we listen to 5 minutes of music, we'll also get ready for testimonial videos. Okay, so we'll just have our testimonial videos first. So
being a sickle cell patient has really taught me a lot. Because first of all, I was made like this, and I know a lot of people that they feel down, they feel depressed, they feel sad that they're, sickle cell patients. They feel like they're not equal to other people. But I'm here to tell you today that as a sickle cell patient, you are actually strong. You are not different from other people. You are not a freak. You're just like me. And I used to be a dancer. I still dance, by the way, but I used to be a professional dancer. Sickle cell has really taught me a lot, because at a point in my life I used to be always down, because we spend months and months and weeks on preparing and trying to work on projects, making videos and practicing, creating choreographies. But sometimes at the day of the shoot you just fall sick, you have a crisis, and then boom, everything just goes back, or everything just falls back 2 weeks, and you're back to being sad. You're back to thinking that oh you cannot do this, everything is just so hard right now. But I was able to be a part of the few people that I know that was able to conquer this mentality. Because growing up out here, things like as a sickle cell patient I'm not allowed to play football, as a sickle cell patient I'm not allowed to swim, as a sickle cell patient I'm not allowed to participate in sports or like strenuous activities. It's true, but when you limit your mind to just doing what everybody says you should do, it just kind of like puts you in a box. Because if I never tried football, or if I never tried swimming, I wouldn't know that I could actually swim really good, or I could actually play football really good, or I could actually dance. That was one of the things they always told me, that you're not supposed to dance, you're stressing yourself. But every time I hear the music, there's just something in me that just wants to express myself. And I told myself that I wasn't gonna stay in that box. I had to come out of it. I had to do something about it. But I was able to accomplish a lot through dance, which was actually quite amazing. And I just want to let you guys know out there that being a sickle cell patient and also being a content creator or an artist or an entertainer has its perks, has its disadvantages. You have to do some things over and over and over again before you can actually accomplish it because of your health. But someone like me, I've been able to pay attention to the whole process. I found out I was sickle cell when I was in primary 5, and ever since then I've always been trying to do the right things. They tell you to drink water, they tell you to take your daily routine drugs. I do those things too, so you cannot be stubborn and not do the things they tell you to do. I mean, I know they contradict each other, but like if you want to be stubborn, you still have to actually take care of yourself, because if you fall sick, you're not just doing it right. And a vascular necrosis happened. I had to be operated on both my legs, and I was advised to stop dancing because they would only hurt me more than ever. I was sad. I was down. My strong mind was weak, So when I had a vascular necrosis, everything kind of like just went down, because I wasn't able to dance anymore. I was just existing. And then that's when I made the transition into music, because I was looking for a way to express myself. I was looking for a way to communicate to people. I was looking for a way to let people know that just because I'm sickle cell doesn't mean I cannot do it. And I was really sad as at the time. Then I started music, started learning how to produce, started learning how to engineer my sound, and I started trying to discover my sound. It was hard at first because I couldn't dance. I would always fall sick. I was just new to the music space, and I was scared. I didn't know how people were going to accept me into the music space. I didn't know how I was going to balance the music and my health at the same time. But I always tell myself, just because they're running in front of you doesn't mean that you're not running. So everybody is gonna finish the race, so you just don't have to focus on other people's pace. So I had to come to peace with myself, telling myself, okay, I know that I cannot dance as much as I used to right now. I have to actually accept the fact and do the right things. I'll take my morning routine drugs. When I feel down, I actually rest. I drink a lot of water, and ever since then, it's just been really good for me. It's just been really easy for me. So yeah, to the sickle cell people out there, I just want to let you know that you can actually achieve anything that you want to achieve. Don't let people put you in a box. Just because you're sickle cell doesn't mean you're weak. So be like me. Create a strong mindset to have a strong body. My name is Kobiro, and I just want to say I love you guys.
Thank you, Kobiro. Thank you. Like, have a strong mindset and have a strong body. So let's not stop dreaming. Let's not stop being who we are. Let's keep achieving our dreams. So next on our list is a musical performance by our one and only Kobiro. Please, let's put our hands together for him.
See me, I was watching myself and I was crying. That's the first time I'm seeing this video too, by the way. So we all saw it together for the first time. Yes. So the song I'm going to be performing was a song I wrote when I felt like everything was over. Because as a dancer, I had a vascular necrosis surgery, so I wasn't able to dance anymore. So I felt like the world had ended for me. And then, it was really down because I went through a very, very long period of depression. I was depressed for almost a year and a half. And that was when I wrote this song. And I just, want to thank God for my mom. So my mom has 7 of us, and then she has 2 boys, and the both of us were sickle cell patients. And every time she would notice that any of us are in pains, she would just start crying because my mom's really emotional. So she would just start crying, and she would come to me, and then she would keep apologizing and saying it's her fault, that she didn't know. And I've never for once blamed my parents for anything. So I always tell her that's not your fault, So I named the song after myself, actually. The name of the song is Kobiro. And the first person you're going to most likely hear on this song is my mom. So you guys should just listen to this, and I love you guys. Thank you. So
this special boy, irrespective of his health condition, being a sickle cell patient, he has this spirit of a fighter inside of him. He's a lion. When he wants to take a territory, he does not give up at all. Just like me, I'm a fighter.
I've been thinking a lot in the night time. I've been smoking a lot, this is my bad. They say, go be yourself while you live dance. Me too, the game no, I know if you do dance. I miss my life when I was smiling and looking bright. A shooting star, I know before come on for sky. So I dare them say, Kobiro the boy, no they ever feel pain. Even the sickle cell he carry for vein. Even when in pain, he go still the boss brain. Say, Kobiro the boy, no they ever feel pain. Even the sickle cell he carry for vein. Even when in pain, he go still the boss brain. Oh, 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 oh na na, 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 oh na na. I'm drifting away from who I used to be, who I used to see. No smile in the morning, in the mirror is the man I see. Me, I try to say that I'm happy. I still put a smile on their faces, because although I show me say the weight it is worth it. So I say the grace when I'm racing. I I want it all. But they don't want me shine. They don't want me shine. So I tell them, say, go to the boy, no, they never feel pain.
So Kobe Raw is my kid brother. I love him so much. He's a go-getter. A little bit of a pain in the behind, but overall, he's a kind person, already passionate about his craft, and it's been really a great pleasure watching him. What can I say about say I can't to say consequences, but yet for this period, anyways.
So that was a song I wrote when I was in a very very dark space. So thank you guys very much for all of this, and to every sickle cell patient out there, I just want to let you guys know that we are the real deal. You know, we got this. So let's just keep doing the right things. Take your money, routine drugs. Don't be stubborn like me. But we'll get there. I'm emotional. Sorry, guys. But like, yeah. Thank you, guys. I love you guys so much. Yeah.
Let's put our hands together for him. Thank you. Thank you for sharing something very personal and very encouraging. Like, thank you. Thank you for being you. Thank you for your story. I always say everyone has a story to tell. Like, it is usually in the unexpected places that you find the strongest people. It is also usually in the unexpected places that you find the fighters. So, to all warriors out there, like, you're loved. Like, you're loved. Don't forget that. Please, let's put our hands together again. So the next thing we're going to do is a panel discussion. This is a time for question and answers, like where we want to be more enlightened, what to do, those pressing questions that we want to ask. Like, this is the time. And on our panel discussion, like, Peace Ogene Bowe is going to answer it. Ogene. Okay, let me not do that.
A very good afternoon to you. I am Peace Ogenegbawe. I hope you took that so that you do that again. I want to welcome everyone to this occasion. It's amazing to have every one of you, both those of you on site and those of you following us virtually. Thank you so very much. And very quickly, I'll be calling those our panelists for today to come take this seat so that we're going to get into it without further ado. And first on my list, okay, it's not here, so I'm going to be starting with a very, very amazing person. Just a minute. Okay. She's a Nigerian writer. She's a public speaker. She's a sickle cell warrior. And she's also a gender advocate working with to eliminate sexual and gender-based violence in Nigeria. Talking about another person than Miss Samira Haruna Sanusi. Please put your hands together for her. She's also a member of Crans Montana. Please come forward. New leaders for tomorrow, the executive director of Samira Sanusi Sickle Cell Foundation, and a programs manager at Anti-Sexual Violence Lead Support Initiative. You're welcome. Please take your seats. Please put your hands together for her. Okay, also joining right here, I'm really proud this afternoon because I'm having amazing ladies, that will be joining us right here on this panel discussion session. And next on my list, the men are already using side eye to look at me like, is it only women? Be coming down. We are going to call the ladies first. I have the right to do that. Yes. Okay, so the next person is an exceptional financial manager, a management consultant. She's a business development expert with over 10 years of experience in leading teams, business incubation for SMEs, and executing wealth management strategies for organizations and individuals. She is a target-driven and goal-oriented person with administrative capacity to recruit and manage talent. She's also a certified money management expert, a fellow of the Chartered Financial Analyst Institute and CFA Society of Nigeria, and has undergone several leadership development programs, notably the Dominion Leadership Program run by the Golden Hearts Foundation. The list goes on and on. She's a mother of a lovely son, her passion for teaching and mentoring people. In fact, if I continue like this, I will not leave here. Please put your hands together as we welcome Mrs. Chinyere Theodora Otu. You're welcome, ma. Please take your seat. Okay, and I also have our doctor that enlightened us this morning. He's an hematologist. He's a hematologist, and talking about another person than Dr. Ovie Ewoga. Thank you so very much, sir. And then last on my list this morning, because we are into media, and if there is anything we do, we talk about inclusivity, which is very, very important. And so we also have the program's director for Inclusive Friends Association, talking about Mr. Olusheyi Moses. He will be here also to speak for the PWs. Imagine when a person with disability is also a sickle cell warrior. We're going to hear about that. Please put your hands together for Mr. Oluwaseyi as he comes forward. Thank you so very much. Okay. Then do we have other mics? You're welcome. All right. So I'm going to be starting with Ms. Theodora. You're going to be sharing a bit of the experience with us. You know, we've heard experiences. I mean, how did you? Your CV doesn't sound like anything, you know. How was it for you? What was the journey like? You just have like 2 minutes, so you just summarize for us.
Okay, for me, I think I had great family support. You know, I'm the only one among 5 children, and I'm the second. So growing up, my mom didn't make me feel any different. She made me feel like every other person, which is one thing that we need to, you know, that's what the psychologist was saying. Don't make them feel different. Don't make them feel they are weak. So if she gives task, yes, she might give my younger sister more, but she ensures she makes me do the things that every other person is doing. Doing laundry, cooking, you know, helping her to go to the market and all that. So I didn't grow up feeling isolated. I felt like every other person. And then at the point where I started knowing that, okay, I was a bit different, I, you know, like Kobiro has said, his mindset, I told myself that what they call you, what you answer to is what matters. And what do I want to answer to? So you people, everybody sit down here, they can say, I'm SS. I don't ever define myself as being SS. I define myself with every other acronym I want. Strong, I'm special, I'm smart, you know. So when you call me SS, that's what comes to my mindset. If I call you peace, you answer because it's your name, right? So if I come and I call you love it, you won't respond to me. So I gave myself my own definition. So when others are being classified as sickle cell, I classify myself as strong and smart, and you know, so that's what helped me go through. And even when there were stigmas, like she said, my own, you know, this thing, if you could see, my leg is all scarred up, lasted for 14 years. I entered the university, I graduated, it was still there. And at a certain point, my dad came to see me in school. I schooled in Ebonyi State University, so I wasn't even in Abuja with my family. Being the only one with a health challenge, it was amazing how I was the only one that schooled far away. Others schooled in University of Abuja. So he came to see me, and we're walking, and 2 girls, we went to the village, and 2 girls saw how I was working, and they started laughing. And I saw how broken he was. And I turned to him and I looked at him. I said, look at me. I'm very beautiful. If they keep me and those two girls, they will pick me before them. So don't worry yourself. So I've always been an advocate for self-love. I've always been so confident of myself. You can't break me. And so I don't stay around negative people. I don't allow them talk negative on me. And then pursuing my career, I know that I'm someone that wants to make impact in my world. I want to leave my name in the sands of time. And so I kept striving to be everything that I am, which is just the beginning, because there's more to come. It's not been easy. Like you say, sometimes you have planned, you have worked, you finish organizing everything, and on the day you break down, you don't show up. So the challenges have been there, but I also have learned to measure my pain threshold. So the moment I feel like a pain is coming, I always have my paracetamol, depending on the level of the pain. If it's a bit severe, I know I will go to ketoprofen. If it is more severe, then I know I have to go to the hospital. When I come down with malaria, I don't try to self-medicate, because after self-medicating, when the malaria is gone, then I'll break down. So it's all about understanding my system too. I know what to do and what not to do. Like the moment I came in, I told her, can you ask them to reduce the AC? Because when I sit down in a cold place for too long, then that can trigger pain. So understanding my pain threshold, understanding what I can allow, what I cannot allow, has really helped me to maintain my health. And if I don't tell you, a lot of people don't really know that anything is wrong with me.
Actually, I've known her for more than 4 years, and I found out just 2 weeks ago that she is a warrior.
And like Kobiro, he put his story in a song. I put mine in a book because I turned 30 in January.
Yes. Let's hear from you, Samira.
Hello, everyone. It's a pleasure to be here. So my name is Samira, and I was born with sickle cell anemia. And my story is, how much time do we have again?
Okay, just wrap it up in like 2 minutes because we are supposed to be out of here.
Okay, I'll try. So when I turned 15, I developed a lot of sickle cell related complications, and a lot of them were misdiagnosed at first. And in the journey of that, I got bedridden. I lost my ability to walk and stuff like that. And that started as what I like to call the journey, because I believe that was when I was really born. It started when I was 15. So after being in the hospital for 3 months in Nigeria, I was taken to Saudi Arabia, where I spent another 3 months. And in the end, they decided that they will have to amputate my legs, and that my parents were just wasting money because I wasn't going to leave. And my dad, being who he is, decided to just broadcast my medical reports to any hospital in any country that will have any solution. Yes. So I ended up in Vienna, Austria, and thankfully they said they were able to treat me, and they also have the cure, the bone marrow transplant. So I spent 7 years fighting for my life, fighting for survival. I spent 6 years of those 7 years on a wheelchair. I had to learn how to walk all over again. Thankfully, I had the bone marrow transplant, which was successful. I've been cured for 20 years now, and my genotype is now AA. So with all the complications that I had, learning how to walk again, undergoing surgeries. I'm 36 years old, and I've had a total of 31 surgeries. Yeah, and I'm still here, and I decided to just...
Let's put it up together. Wow.
Yeah. So basically, that's a bit of my story, and moving back to Nigeria was when I realized the gap in the care for sickle cell anemia, the standard of care, the management, the treatment. Earlier, the psychologist mentioned something about combining the medical aspect of it with the psychological aspect of it. I remember when I was in the hospital here, I was just left to my own devices and I would get lost in my head. And there were so many nights when I'll ask God to just take my life. And it was so different when I was in Austria, because even though I know that in the morning they will have to sedate me to just turn my position in bed, and then I'll have to go through excruciating sessions of physiotherapy, I knew that at the end of the day, I'll look forward to things like art therapy, music therapy, or just someone coming to chat with me, and stuff like that were what helped me to cope. So I think it's something important that we can advocate for. While we're treating the illness, we're also helping to support people living with it.
Okay, we're going to get into the question and answer session very soon. So if you have questions, if you're following us virtually and you have questions, you could just drop them on the comment section, and we'll definitely pick as many as we can pick, when we get to that session. However, let's get to the place of medical care and advocacies. I also manage a health challenge at the moment, and one of the things that I think is what we see in Nigeria right now is the fact that even medical personnels that are meant to be first responders seem to be more about the business part than the main thing, the reason for the earth, the soil, and all that. What has been done to help the medical personnels, understand the fact that these people we need them. Yes, I'm part of it. Like, we need them, more than the money part. Because Samira's story, for instance, she had a family that could help out. Chinyere, for instance, had a family that could care for her. Not financially, but then had family that could care emotionally. There are people that do not have any of this. And their only faith, author of faith, is the medical personnel they get to meet. And then, what happens? What would you say about what's been done? Policies, trainings, advocacies has been done to help medical personnels do right by the warriors?
First of all, I would say, for you to be a doctor, it's a calling. For me, it's a calling. And when you don't have that calling, of course, you wouldn't treat people the way you're supposed to treat them. That's a simple truth. And no matter what you do, if that person is not ready to change, there's no empathy, you can never do anything. The group of young people we have today, doctors we have today, tend to run to the profession because, I want to make some money. The real sense, the care for the patient is not in their minds. If you heard what I said earlier on, I work with younger colleagues. If you want to get me angry, then you don't treat them well. Because the truth remains that if you want as a patient, then you definitely treat people right. Because if people treat you the way you've treated some other people, how would you like that? And that's the message I have passed to my younger colleagues. You must treat everyone just the way you want to be treated. So no matter the degree, amount of training you give to people, when that person is not ready to change, that person has no interest, has no empathy, you can go nowhere.
That's one, I must say. Let's get to Mr. Luashi Moses. You work with the persons with disabilities. I can imagine when one is as a warrior and also having some sort of disabilities. A normal person having disabilities is already something, and then adding that to it, I could just imagine what it is going to be like. What would you want to say about such persons?
Well, thank you very much. And coming to this place today, I must say that it's actually a very wonderful gathering, and I'm glad I'm part of this today. Yes, talking about sickle cell anemia, because my mom is a nurse, I have an aunt who is also a sickle cell warrior. Thanks for that terminology. Who is also a warrior. And we grew together in the same room, and she has a very wonderful heart. She turned 50 last year. And so this process is a process I am used to. When she talked about the AC on, I know if you must give my aunt a gift, look for very thick socks. You understand that. But the good thing here is, first we must establish that there's something you need to understand. You are first human before you are called someone with before you are called a warrior. So the fact that you see it from the perspective, which I really want to change that narrative, I hope I'm able to, when you say you have finished planning, you have finished putting all of the hard work, and on the day of the event you break down, that can happen to anyone. Stop seeing it like it happened to you because you are a warrior. I can get prepared for an event, and on the day of the event, I'm unable to attend. So don't let it be like some form of a weakness, some form of a stigma, some form of that people begin to see you from the point of, hey, yeah, you get it. Let's begin to engage. Being an advocate for over 15 years in the development space, I engage issues from the point of rights and not from the point of sympathy. What is the law saying about what belongs to you? And I can imagine how much of your colleagues would have looked at you, now only you sabi this thing, because even when they call up, when they say there are strikes, I can imagine you still going to treat warriors and other patients. But looking at it from the point of persons with disabilities, yes, some warriors eventually become persons with disabilities. While you're on the wheelchair, that already talks about physical disability. I see you use walking stick. Some persons sleep. That already talks about different clusters of disability. That talks about perhaps low vision, which of course it could also affect sometimes their hearing ability, their physical ability. So that brings us into that. And for the fact that we then kind of have a correlation of disability, then there's a law that protects your interests. And I would like to speak to how warriors can take advantage and how can take advantage of existing laws and can also begin to engage from a different point of view. First issues I like to bring on the table is the issue of awareness. I think we must go beyond waiting for June 19 before we begin to talk around this. And how do we go about this? Is creating coordination between the media practitioners. There are several media persons who even want to talk about some topics. Don't let us wait until it is June before we talk about this. Because a lot of persons are not even as aware as you are. So some persons still look at warriors and say sickle cell patient, which of course, understanding that you use the term warrior, that already becomes stigmatizing, that already becomes some form of hate speech. So I think we need to begin to create more awareness, which I think for me is really important. Then I look at it from the part of gender. For everything, a female is already discriminated, even from birth. Mama, baby. It's stigmatizing. That's the truth. They are telling you you don't have a boy. What makes it different? That person who is a boy can also be a girl. There are so many successful persons. Are we together? So I think once you now see warriors, female again, that's already a gender issue that I think we need to begin to engage from the gender perspective, demanding for their right, the 35% affirmative action and all of that. So I think it's something that we can engage properly. I've talked around the issue of media. Then we must also begin to look around inclusive structures and systems. So the way I came into this hall is not the way my sister Samira would have found it comforting coming into this hall, which of course is also part of the provision of the Discrimination Against Persons with Disability Act, talking around accessible systems and structures. So even when warriors are also organizing events, we also now need to begin to consider, what about other warriors who would find it difficult climbing the staircase? So we begin to tell buildings who perhaps don't have accessibility in consideration, we will not come to your place. When we begin to turn some of these people down, they begin to think the need to create systems and structures that will give us better living. Then there are issues around reasonable accommodation. Reasonable accommodation goes beyond, because you're a warrior, I've given you job. No. You must also create an enabling environment that will make me thrive in that office space. So you have given me an employment, and then you tell me, you can just come once in a week. You have just told me I'm a failure. That's exactly what you have said. So you need not just giving the employment, but there is a place for reasonable accommodation. And all of this we can just take advantage of technology. And then there are needs to quickly, for us to begin to engage health issues. So we don't wait to begin to say our health system, our health facilities. September is another midterm infrastructure time when they begin to talk around next year's budget. What are we doing? What effort are we putting together as warriors alongside other civil society organizations that we begin to push for budget line that attends to issue of sickle cell anemia? How do we begin to build coordination between warriors and medical practitioners who are not just medical practitioners for the money, but because of the passion and the love they have for warriors, so that we can begin to push? I know my time, give me 30 seconds, I'll round up. So that we can begin to push for budget line. Having budget line will help attend to people who do not have the opportunity Samira have. There are so many people who are there. Imagine children who were born as a result of the insurgency, Boko Haram, and their sickle cell anemia. Who attends to them? How will they get to Saudi? How much more of going to Australia? I think these are issues then we need to begin to look at. Others, I'll just say it. We need to look around identifying champions. Identifying champions is, these are champions already. What can you do to ensure that other persons get this benefit? I round up on this to say that we also need to identify stakeholders. Mapping stakeholders. There are lots of traditional institutions who we can speak to. There are several religious institutions. And there are also the private sector that we need to identify. A lot of these telecommunications have foundations. A lot of these salt, sugar companies that we consume on a daily basis have foundation. These places we all go to buy pizza and burgers. What are we telling them concerning warriors? Thank you very much.
Thank you so very much. You know, one of the things we had planned out for this event was to undergo genotype testing, but that was not possible because of our time space. You know, it's part of the awareness, and we are hoping that before the end of this year we'll be able to put together that, you know, probably to the rural areas, because they need to know that, okay, I am AS. If this someone comes for my hand, and he needs to check his genotype and be sure, so that we don't do that. I don't know if we have questions online. My technician, I don't know if we have questions online. However, do we have questions in the building? All right, please. Any more questions? Any other question? Okay, we have 2, 3, all right, 4. All right, then. We'll take the 4 questions very quickly while we check for questions online. All right, please come forward.
Good afternoon, everyone. My name is Mariam, and I know that a lot of you have mentioned having communities that have to do with raising awareness on sickle cell diseases and how to be more accommodating with the warriors and all of that. But my major concern now is about the people living in rural areas. Are you making deliberate efforts using your platforms to reach out to them? Because these are people that are illiterate, ignorant, and most likely do not have that level of enlightenment concerning sickle cell. So what efforts are you putting into reaching out to those communities, especially through harnessing the power of the media, because that's the one of the most effective ways we can reach out to them. What efforts are you putting into reaching out to people at the rural communities to raise awareness on sickle cell? Thank you so much.
Thank you very much. I think we should take all the questions together so we can wrap up. Next person, please. See him.
Good day, everyone. I'm Architect Alamin. My question goes directly to the doctor. In the course of your lecture, you discussed about female getting married, but you never mentioned the aspect of men. From my own experience, I've been with a lady. It was almost time for introduction. That was when she told me that she's having second thoughts, and I asked her why, and she said her friends and family have been talking to her, and she doesn't think she can live with someone that is going to be a burden to her. That has stuck into my head. Anytime I see a lady now, I just back off. No matter how you try to get close to me, I back off. So how do I get to remove that image from my head? Because all I see now is I am a burden to someone's daughter when I'm sick.
Thank you so very much. We have, okay, Ma.
Oh, okay. Good afternoon, everyone. I have two questions to ask. And one of the questions will be centered around education. And second will be centered around a question I've seen several speakers ask, and it hasn't been answered. And I have suggestions for the two. So regarding the question, so one of the questions is integration of the social clinical components in the clinical settings. You know, I work in the field of public health, and specifically of HIV programming. And HIV programming too is also something related to blood. And again, there is a program component, national level in various countries. I don't know who is listening to this program. If there can be a programming section of sickle cell, where we have it at the national level, where they are being coordinated, it's going to go a long way in integrating a social component, especially when a client goes to the hospital, they are being managed. They are going to be also being managed by a psychological expert, you know. So, but all of this, you can have that in a private clinic, right? But at the national level, let's begin to look at it from that level. Is there anybody that is even organizing this disease? And the second question is the need for the stigma. Addressing the stigma. This program really enlightened me because I thought I used to have a perspective about it. I am not a warrior, but I'm a carrier. I have an aunt that died of this disease when she wanted to put to bed, and that has spoiled my energy since I became aware of this disease. So let's begin to educate. It's not about educating just when you want to get married. I think this should be incorporated into the education sector. Let's have it as part of the curriculum of the education. Like everywhere, everybody shouting climate, climate. Let's begin to shout sickle cell at the level of education, even from primary school. Let everybody be aware of this. If we can enlighten people about this disease, it's going to go a long way. A number of people still are not aware of this disease. I know a couple that went into marriage recently. AS is an AS. You know, and the complication of this disease, you might not really know until you are a victim. So let's begin to look at it from that perspective. Thank you.
Thank you so very much. I will take Majumoke before we go. Josephine, sorry.
Good afternoon once again. I just want to use this medium to see the advocacy going on in schools, especially primary and secondary schools, based on the fact that like I told you, that I run a Sickle Cell Foundation and I'm a Sickle Cell warrior myself. We've tried to reach so many schools within Abuja, private and government, and we see that it's been very difficult. Most of these private schools, be it secondary, primary, it's like they are more interested in something beautiful, something this cultural day, something that makes parents to glow with pride and things like that. It is not bad, but we are saying the knowledge of this, knowing your genotype, the issue of information and education, even from this level, is very key. In primary, secondary school, we are just using this opportunity to say, help us to make that appeal, to allow these talks in their school. It's part of what the children need as they grow up. You know, when you take informed decision from that age, it's better. Then for the government schools, the conditions are very difficult. Sincerely speaking, in as much as I don't want to go into some things we've approached a lot, and sincerely speaking, you think that we are actually looking for a contract. And then and it is a space that goes wider. So we just want you to use this platform to make that appeal to, and I don't know if they have something to say concerning that.
All right, thank you so very much. You know, fun fact, I started my love and interest in advocating genotype testing and all that from primary school. Yes, because what happened was my proprietors, I don't know how, they just organized this, and parents were meant to pay for it. They were meant to pay for their children to get tested in school. And the full day, I think 2 days or so, was dedicated to that. So these experts came to the school, and for every child that paid for that, they passed through genotype tests. That was the first time I found out what my genotype was, you know, aside the fact that my parents knew about it. So I think, yes, you know, if, I mean, proprietors, educational stakeholders listening to the sound of our voices, it's not something bad. It's not something bad. Do you know that 90% of relationship issues can be sorted out? He broke my heart, she broke my heart. I will not marry again in this life and the one to come will be sorted out if you know your genotype. Yes, because they've gotten to the point where they're almost saying I do, and then the thing just comes up. Most of them, it is when they've gone to the church, then the pastor will say go and do the test, then they will now find out. I mean, we don't have to go through all that if we do what is right now. And that's why we're thinking towards starting a community drive. If schools no go let us enter immediately, you know, government schools, for instance, we can go to the communities, talk with the traditional leaders and all that, put out a medical outreach. It's just for genotype testing. So if you no go allow us do it for school, we'll do it for the house. They go still know all way now way. Now we see that one. All right, let's get to the questions very quickly. So who is going to be answering? I think, okay, so that we can wrap up. We are way behind schedule.
You know, there's no money in sickle cell.
True word.
There's no money. And so the government is not interested in that. You know, in HIV, there's money. Maybe they will say there's no money now. You know, the problem we have with the government is that most of these hematological conditions, the government is not interested in them because they're quite expensive. So, you know, even the hydroxyurea we're talking about, the government does not even provide. It's not even in their inclusive list now of the NHIS. So there's politics there. There's no willpower there. You know, as he said, you know, advocacy, we keep doing that. You know, legislature to follow, you know, and then we feel maybe someday we'll get there. But as we speak now, there's no money. And because there's no money, nobody's interested in, you know, in charting that course. About 39 years ago, I was 11 years old. I'll be 50 this year.
Congratulations, sir.
Thank you. We're at home, you know, I think I was in primary 4 or 5, and then Rotary Club came around and then packed us. There's this man who was a retired at that time, moved us inside one bus like that, took us to the old youth, and then they took our blood sample. I don't know what they were doing, no. And then they came back, they snapped our pictures and gave us ID cards. So I got to know what that was. You know, I just saw the ID card. I didn't know what it was. But years later, a picture of my father discovered I am AS. So in my wallet, for so many years, I had that in my wallet. So when I'm dating you, what's your genotype now? Let's talk. If you keep quiet, that means you want to kill me. Yes, you must tell me. If you don't talk, we'll go our separate ways. So I had that 39 years ago. That was when the country was even like good. You know, you had organizations that would just come, as you said, community screening and things like that. Again, we shouldn't relent. We can still go ahead and do that. And then to your question, architect, when I talk about ladies, the men are also included. You know, as I told the other lady, do not allow anybody to run you down. Don't allow just an experience with some ladies to weigh you down. The right person will come for you. Do you understand me? So expunge that from your mind. You're doing well, you're an architect. We're just discussing with you. You work with the Federal Mortgage Bank. You're doing very well. So why should a lady waste your time or make you to feel very bad about who you are? She said you have to define who you are. I have worked on my mind as a person. I don't allow things bother me. What you cannot be able to resolve, allow it. Don't bother yourself about anything. Just keep doing your work. Maybe if you go to the field to supervise your projects, it's one beautiful girl that will be chasing you. Open your mind and collect her. Do you understand? I'll move.
Sharp.
Thank you very much. Just a quick one I want to add. Earlier during the introduction, and one of the things we do, one of the bad habits that you actually asked us to say, I heard the architect said he overworks himself, takes work from office and takes it up. And in my mind, I said, this man is doing this because he's trying to cover up something. And so you must be intentional about your identity.
Yeah.
My brother, it's not because you are a warrior. A lady has once told me, I can't date a short guy. Will I increase my height? No, but that's the truth. I can't increase my height. You get it? First, you did not create yourself this way. But I also believe God has never made mistake. Do you get it? What you carry, you are unique in your own. That's the truth. And this is what one lady is looking for. Somebody who has our color. You know, it's only me, you, and you here that have same color. There are ladies who are looking for this color. Please don't deny them. You understand? So the ball is in your hands now. A lot of persons must have been looking at you. You know what it means to be an architect? You go sit down in design house and then you are here. You are more attentive. You pay attention to details. You are not like people like us. So what you carry, please just know that you carry a lot inside of you and don't turn yourself down. And then the issue around school and government. Let's not quickly feel government has not been doing anything around issue of genotype. But the truth is, it is the us, citizens, every driver's license, right from a long time, always carry that. So government has also been very conscious about some of these things. So we all just need to realize that where did we get it wrong and how do we go in back? And so it requires us not working as an independent person any longer. Let us see how we come together and collaborate. A lot of churches do outreach, health outreach, but what they do is malaria and paracetamol. So let's begin to engage from that level. Can we begin to do genotype? And again, awareness, we must not put it off. A lot of these things have been happening, and the Yoruba land, they call it abiku, not knowing that it is the same sickle cell anemia. So we need to increase our advocacy awareness. We also need to put into collaboration so that we can achieve more. Thank you.
Thank you. I mean, architect, okay, is out. A lady just called. I'm telling you. Let me keep what I want to say. Architect is not around. Okay, ma'am, go ahead.
Okay, I think I want to talk in line with what he just finished saying. Collaboration. she asked the question of, can we have this thing done in national level? You are here doing this in this space. You probably have another organization somewhere doing it in a smaller space, another place. What happens if these ones who already have NGOs for sickle cell warriors can come together and plan something that will be bigger than them? Because the problem, okay, in business, we advise collaboration a lot. What I will achieve as an individual, if I team up with him, we will go further because of his networks, because of his experience. When we all bring our different experiences, our networks, you know, and bring our ideas together, you see that that little dream that you're looking at like this becomes bigger than you.
Yes.
And so if NGOs, that if we can identify NGOs that are working with sickle cell warriors, and someone has to take the initiative, maybe it has to be you, and say, okay, fine, you run an NGO, you run one, but on so date, we want to have a national conference. Before, I've met a guy who was AA, and he told me, he said, see, I love you very much, but I can't imagine my children growing up without their mother. I say, eh? I said, look at me very well. In this life, me, I will attend your burial. So you need to know who you are. How can you wish me dead when I'm not even dead? You're already picturing me seeing the children growing up without their mother. We talk about, you know, vision board in business. Draw the vision you want to see. And the vision that guy is casting of me is a wife that will give birth and be dead. No, I don't want to be around such a person. So I would rather be single than marry such a person. So you should also tell yourself that any girl that can't see the potential in me, I don't need her.
Simple.
Because you are an asset to anybody you go into their lives. Do you know why? As a warrior, you have empathy. You've been through a lot of pain. So when you see someone that is sick, you know how to take care of them more than any other person.
Oh.
You feel what they feel. You have been there. You have even been worse than what they carry when they call themselves, when they are not feeling well. And one thing you should know, I tell people, for a warrior that knows herself or himself, you are healthier than AA. Because AA drink any kind of water, they fall sick. Malaria pass, they fall sick. Breeze blow, they fall sick. So what are you talking about?
Ew.
So don't let anybody sit down there and make you feel less of who you are.
Thank you so very much.
Less of who you are.
Yeah.
But you need to accept that from your mind first. And when you can accept that, people will pursue you.
Thank you.
The last thing I want to say is develop so much value in yourself that people know that they need you.
Hey, Samira, do you want to give one word before we go? Okay, please, you have to make it very snappy.
Okay,
Sorry.
so I just want to reply to Mariam, who talked about the need and level of awareness, especially in rural communities. So, for example, my organization, Samira Sanusi Sickle Cell Foundation, we're based here because I live here in Abuja, but 90% of our activities, outreaches, and engagements are carried out in northern states, because even when it comes to sickle cell awareness, you find that we have more patients in northern states where there are issues like cousin marriages. And then there are things like we don't really need to go to the mosque to tie the knot. It can easily be done. Like my wedding was carried out in my dad's living room. So many families do not prioritize the need for bringing a genetic compatibility test result. And our part of our work is to engage as many religious leaders as we can to talk about it from an Islamic perspective, and then also cultural leaders and everyone to get involved. So we also use radio, traditional media, sensitization programs in schools. We collaborate with general hospitals and stuff like that to carry free genotype tests. and stuff like that, just to make the information accessible to people who are not online and stuff like that. And then another thing is to make sure that you do it in local languages that they will understand as well, not just English. And yeah, that's basically.
Thank you so very much. Okay, and we have come to the end of the panel session. I want to say thank you to all our panelists. You guys have been amazing. Thank you so very much for coming. Please, as you get to stream Kobiro's song, make sure to get Madam Chinyere's book also. I mean, it's amazing, and you just have to do something about sickle cell. We're all doing this together. You know, interesting thing is that myself and my partner, we're both in the media space, and we decided to put this together, you know, because we love advocacy and we want this word to spread very fast. Thank you so very much. My name is still Peace. Ogenegbara is back to Ngozi Ibe as she wrap up the event. Thank you.
Thank you. Like this session was one of the best sessions for me. I had plenty to do, plenty to go with, you know, and I'm so happy, I'm so grateful. Like one of the people that made one of the groups or one of the people that made this happen today is P7 Initiative, and I want to call them on for a goodwill message. But before they come on, I want to talk about connecting. You know, this is a place for us to connect. This is a place for us to like connect. For everyone that has, like, initially when we started, I talked about people who have one healthy thing they do and then one unhealthy thing they cannot stop doing. While we talking about it, sometimes it's like when you speak out something, you are able to begin to see how wrong or how good it is. So even if you want to dwell more on it, you know, there is a chance for you to change. So let's call P7 Initiative. Thank you for making this possible. Thank you.
Thank you. Good afternoon, everybody. My name is Barrister Ivy Pisogewonyi. I'm the Executive Director, P7 Initiative. I didn't know this was going to happen, but it's fine. So at P7, we are about the well-being of youths, basically, everywhere. The boy child, the girl child, all around. And we took interest in this event because there are a lot of youths who are sickle cell warriors and who are carriers. In my family, I have a couple. I myself am a carrier. So when Madam Chinyere was saying, even the AA, if breeze blow, they are sick, it's the truth. We are, in the long run, stronger when we do the right thing. For as long as we take it seriously and we adhere, or we are diligent in our care, we will be stronger. We are stronger. And we should never, ever let it define us. We did not create ourselves. We cannot then limit ourselves. So I think that's just all I want to say. Thank you very much. It was amazing being here.
Thank you. Let's put our hands together. Thank you all. Thank you all for being here. Thank you all for making this work. You know, thank you for all your inputs. Thank you to Big Head Daniel for working this out today. Like, I'm so grateful to be here. Thank you for peace. You know, thank you for everyone that made here possible, you know. So like I was saying earlier, this is a place for connect. This is a place to connect, especially Mr. Engineer. Connect here. And don't be too busy. Please have a social life. Do you know how beautiful you are? Like God. Okay. So this is exactly why this was made today, and then it fills my heart with so much joy, like that we have safe spaces to be ourselves, safe spaces to not feel anyhow, to not feel pressured. So I'm glad this happened. Kobiro, thank you for being Osisa. Thank you for being you. Thank you, Auntie Chinyere. Thank you, Mrs. Samira. Yeah, thank you for all being here. So have a restful day and enjoy yourselves. Bye. So please do well to invite me to any health outreach. I am very available to ask people what their best healthy thing is and their worst healthy thing. So do well to invite me and I'll be one call away. Yes, please. Yes, we can do a group picture.